Monkeypox is a rare viral disease that is caused by the monkeypox virus. It belongs to the same family of viruses as smallpox, but it generally causes less severe illness. Monkeypox might sound concerning, but several factors help explain why it might not be as severe as it seems on social media. However, the symptoms might surprise you. Early symptoms. Monkeypox typically starts with some flu-like symptoms, so it can feel a lot like getting a bad cold or flu. Here's what you might experience. 1. Fever. One of the first signs is a high fever. It can make you feel like you're riding a hot and cold roller coaster. You might find yourself alternating between feeling sweaty and then chilled. 2. Headache. Alongside that fever, a frothy headache could make you just want to lie down and rest. It's not the sort of headache that goes away with a quick break. It tends to stick around and be quite bothersome. 3. Muscle aches. You might notice muscle aches and backache. Imagine the soreness you feel after an intense workout, but without actually having exercised. It can make even simple tasks feel tiring. 4. Chills and exhaustion. Chills and overall fatigue are common, too. It can feel like your body is asking for a nap, and you might find yourself feeling unusually tired and worn out. Rash development. As monkeypox progresses, a distinctive rash starts to develop. This rash goes through several stages, which can be pretty distinct. 1. Flat red spots. The rash often begins with flat red spots on your skin. These are typically the first noticeable signs of the disease. 2. Bumps. The red spots then evolve into raised bumps. They're like the first stage of a rash. Not yet filled with fluid, but definitely noticeable. 3. Blisters. The bumps will develop into blisters filled with fluid. These blisters can look similar to the ones you might get with chickenpox, and they can be quite itchy. 4. Pustules. After the blisters, the next stage is pustules. These are bumps filled with pus. They can look a bit alarming, but it's a normal part of the progression. 5. Scabs. Finally, the pustules dry up and form scabs. These scabs will eventually fall off, and the skin underneath will start to heal, where the rash appears. The rash usually shows up on the face, arms, legs, and sometimes other parts of the body. It can be a bit itchy and uncomfortable, kind of like having a mild case of chickenpox. It's often a good indicator that something's going on. Swollen lymph nodes. In addition to the rash, some people might notice swollen lymph nodes. These are small, bean-shaped structures in your neck, armpits, or groin. When they swell, it can be a sign that your body is fighting off an infection. They can feel tender or a bit puffy. What to do if you think you have monkeypox? If you start feeling unwell and think you might have monkeypox, especially if you've been in contact with someone who has it or visited an area where monkeypox is common, it's a good idea to get in touch with a healthcare professional. They can provide the right advice and help you feel better. Managing monkeypox. Most people recover from monkeypox with just supportive care. This means resting up, staying hydrated, and managing symptoms with over-the-counter medications if needed. It's important to follow your healthcare provider's advice to make sure you're on the right path to recovery. Preventive measures. To help prevent monkeypox, practice good hygiene. Wash your hands regularly, avoid close contact with anyone who has symptoms, and be cautious around animals that might carry the virus. If you're in a high-risk area, the smallpox vaccine can also offer some protection since it has cross-protective effects against monkeypox. Remember, monkeypox might sound serious, but with the right knowledge and precautions, you can manage it effectively. Stay informed, take care of yourself, and don't hesitate to seek medical advice if you have concerns. Thanks for watching. Remember to like, subscribe, and hit that bell if you want to see more like this.